Hello everyone. In today's session, uh, we are going to talk about the a very important topic that is the foramens of the skull, and it might be useful to people who are studying anatomy, dentistry, medicine, and surgery. The word foramen means the opening or a hole in the bone. These openings allow nerves, blood vessels, and other structures to pass between the cranial cavity and different parts of the head and neck. Uh, so, foramen is a natural opening in the bone through which the nerve, arteries, veins, and ligaments pass. And the skull contains numerous foramens, especially at the base of the skull, that is the cranial base, allowing communication between the brain and the rest of the body. Uh, Biggest foramen is the foramen magnum. The foramen magnum is the largest opening in the skull and is located in the occipital bone. What are the important structures that pass through this foramen? Uh, Medulla oblongata is, of course, one of the most important uh, structure to pass through the foramen magnum, containing the spinal cord. Then we have the vertebral artery, which supplies the brain. Then it is the spinal roots of the accessory nerve. Uh, then anterior spinal artery, posterior spinal artery, and meninges. Clinical importance of this foramen is that the compression at the foramen magnum can be life threatening because the vital centers controlling the respiration and circulation are located nearby. Cribriform plate or cribriform foramina is located in the cribriform plate of the ethmoid bone. The structure that passes through the cribriform plate is the olfactory nerve fibers. These fibers carry the sense of smell from the nasal cavity to the brain. Fracture of the cribriform plate may result in loss of smell, known as anosmia. Then we have the optic canal located in the sphenoid bone. Structure passing through this optic canal are optic nerve and ophthalmic artery. It provides visual information from the eye to the brain. And then we have the superior orbital fissure, a large cleft between the greater and the lesser wing of the sphenoid. Mm, Now, the structure passing through this, quite a few are there that pass through this. So, first of all, is the oculomotor nerve, then trochlear nerve, ophthalmic division of the trigeminal nerve, abducens nerve, and superior ophthalmic vein. So these are the structures that pass through this foramen. Then uh, the function is that it supplies muscles responsible for the eye movement. Then we have foramen rotundum. Foramen rotundum is located in the greater wing of the sphenoid. The structure passing through the maxillary nerve. And the importance of this is it provides sensory innervation to the midface. Then we have foramen ovale, one of the most important foramens in dental anatomy. And the structure passing through this foramen ovale is the mandibular nerve. Mandibular nerve is part of the trigeminal nerve, that is the fifth cranial nerve. Accessory meningeal artery, lesser petrosal nerve, and emissary vein. Um, it is used as an access point for trigeminal neuralgia procedure. Uh, Foramen spinosum. Foramen spinosum is located posterolateral to the foramen ovale. Let us see what are the structures passing through this foramen. The first one is the middle meningeal artery, then the middle meningeal vein, and meningeal branch of mandibular nerve. Clinical significance: rupture of the middle meningeal artery may cause an epidural hematoma. Foramen lacerum, located at the junction of the sphenoid, temporal, and occipital bone. Uh, the structures that are passing through this are the internal carotid artery passing over the upper surface, greater petrosal nerve, and deep petrosal nerve. Uh, so now we have internal acoustic meatus, that is the canal of the internal ear, and the facial nerve passes through this. Vestibulocochlear nerve passes through, and labyrinthine artery. Uh, it is responsible for hearing and balance. Jugular foramen, situated between the temporal and occipital bone, and the structure passing through the jugular foramen are the glossopharyngeal nerve, vagus nerve, accessory nerve, and internal jugular vein. And lesions may cause swallowing and speech difficulties. Then we have the hypoglossal canal. Hypoglossal canal is located superior to the occipital condyle. Structures passing through this hypoglossal canal are the hypoglossal nerve, and it functions to control the tongue movement. Stylomastoid foramen, located between the styloid and mastoid process. The important structures that pass through this foramen are the facial nerve, stylomastoid artery. Injury may result in facial paralysis. Then we have the infraorbital foramen, located below the orbit of the maxilla, and the structure passing through this is the infraorbital nerve and infraorbital vessels. The importance in dentistry is that it is frequently targeted during local anesthesia procedure. And then we have the mental foramen, located on the anterior surface of the mandible, just below the premolar region. And the structure that pass through mental foramen are the mental nerve and the mental artery and vein. Again, uh, it is a it is a clinical uh, important point where the mandibular surgeries and local anesthesia also is given. Mental nerve block is given in this area. And we have the mandibular foramen, located on the medial aspect of the mandibular ramus. Mandibular foramen. What are the structures that pass through this mandibular foramen? Inferior alveolar nerve and inferior alveolar artery and vein. Site for inferior alveolar nerve block used. So we have covered all the foramens of the skull. Hopefully the information will be of use to you.